Hi, I'm Yasmeen Zainal. I'm a clinical embryologist here at Child Fertility in Saudi Arabia. I am a graduate of a Master's in Clinical Embryology from the University of Oxford in the UK. Today, we're talking about fertility here with Dr. Tim Child, the Chief Medical Officer of Child Fertility, to help people gain better knowledge and understanding of fertility and what it means to help make better decisions for building their families.
Okay, so we're going to have a general chat first of all. So whilst we get going into this, so Yasmeen, tell me about your training today. So what have you're an embryologist, you're a clinical embryologist. What training have you done to become a clinical embryologist?
So I studied in the UK at UCL in London in human sciences, and then afterwards I did a master's in reproductive science and women's health, also at UCL. After which I moved back to Bahrain. I did an internship at a military hospital in the IVF center. So that was a rotation in andrology, embryology, and in the cytogenetics lab.
What's andrology?
Andrology is male fertility.
Okay.
After which I went to the University of Oxford. I did
The best university in the world.
The best university in the world. I did my master's in clinical embryology at Oxford, and as you know, you're one of my professors there. And then I came back to Bahrain. I worked as a clinical embryologist for 4 years before moving over here to Saudi.
Okay. So what were the high points of your time at the University of Oxford?
My year at University of Oxford was one of the best years of my life, to be honest. It was very, very intense. Made a lot of amazing friends, and just the whole university experience of matriculation and studying so hard, and the intensity of the program and the lab training that we got there was really good.
And how would you use that training that you got at the University of Oxford in embryology? How would you use that in your day-to-day work in an IVF centre such as in Riyadh?
We learned all the skills in the lab, as well as all the theory of understanding the science of fertility and reproduction, and all the skills in the lab to be able to do semen analysis, to look at eggs and embryo development, and everything that comes in an IVF lab.
And do you think the training at both University College in London and also University of Oxford, do you think it trained you to think in a certain way or to maybe be more inquisitive about things?
Yeah, so you get to really understand all the science behind it, and looking at all the different research and studies and evidence for treatment options for patients that apply in the clinical setting.
So it makes you sort of think about why are people having a treatment, what's the best cutting edge treatments to bring into it, which is what we're bringing to Riyadh with what we're doing.
Yeah.
Excellent. Okay.
So let's start at the beginning and understanding fertility, what fertility means, and why it's so important as a first step to planning a family with confidence. So what is the definition of fertility?
Well, I think most people go through their life presuming that when they want to have children, it will happen. And then obviously they're very shocked and surprised when it doesn't happen. So it's considered normal to take up to 6 to 12 months to get pregnant. And loads of studies show that around 8 out of 10 women will get pregnant within about 12 months of trying. So the definition of infertility is if people haven't got pregnant after 12 months of trying. So traditionally, that would be the point at which people might start having some tests and investigations. But if people are worried, or people have a history, so a background of some things that could affect their fertility, or maybe if the woman's a bit older, probably by 6 months of trying, that would then be the time to start thinking about having some tests and a chat with a fertility doctor.
Yeah, because it's also really common in this region that, if a couple have been trying for 2-3 months and they don't get pregnant, they think something might be wrong. So then they're worried and they might seek treatment a bit too soon.
Yeah, I mean, it's not wrong to go and have a chat with a specialist even after 2 or 3 months, or even perhaps even before people start trying to get pregnant, just to make sure that their health is in as tip-top condition for the couple as it can be. And maybe there is something that's underlying that can be fixed with some hormone tablets or something like that. So people are worried about it, even if they haven't tried to get pregnant yet. It's always worth having a chat. But I think they need to choose where they go to. They need to go to somewhere that's not trying to sell them things. They need to go to somewhere where the doctors and the team are really have the patient sort of well-being at the forefront of their mind. So giving them the best tests at the right time. So I think if people are worried about getting pregnant, or if they've been trying for 2 or 3 months, or at any point, that's the time when they should seek some advice.
Yeah. So let's go back to basics a little bit so people can understand what it is about fertility that they should expect as normal for the female and for the male. So maybe we start with the female. You tell us a little bit about a normal menstrual cycle and the reproductive system and the organs involved.
Yeah, so essentially for someone to get pregnant, there's 3 things that need to happen. So the woman needs to release an egg. The man needs to, they need to have intercourse, and he needs to leave some sperm inside her vagina, and then the egg and the sperm have to get together. So there needs to be a fallopian tube. So it needs an egg, a fallopian tube, and somewhere for the embryo, which will come on to implant in her uterus. And also there needs to be sperm of a normal amount. So there's those 3 things really. So from the egg point of view, if a woman has got regular menstrual cycles, so she's having a period every 3 to 5 weeks or so, and it's fairly regular, that is highly suggestive that she's ovulating. So she's releasing an egg per month. We can go on and do some blood tests called progesterone blood tests, or even some urine checks for hormones to confirm she's ovulating or releasing an egg. But having a regular cycle is highly suggestive. So the first thing is releasing an egg. The second thing, as I mentioned, is for the egg and the sperm to meet, the couple need to be having intimate relations, but also her fallopian tubes need to be open. So what we do is we do an ultrasound scan to check that her uterus looks normal and to check that the fallopian tubes are open, that the egg and the sperm can meet. And the third bit that I mentioned, which is on the husband's side, on the man's side, is a sperm test, just to make sure that he has got the right number and the quality of sperm. But we can obviously go into that in more detail.
So how many times or how often do you recommend a couple to be having sexual intercourse for fertility?
Yeah, it's a really good question. And that's a question that I'm asked a lot by patients. The advice in the UK is that really people try and avoid timing for sexual intercourse, because the problem with timing is if you get it wrong and you miss the window of getting pregnant, that's actually contraceptive. So you might be actually doing a bad thing. So the UK advice on this is that couples should be encouraged to have sexual intercourse really through the cycle every 2 or 3 days. So a couple of times a week. People don't need to be having intercourse every day. They don't need to be trying to time it with urine predictor kits, or even worse than that, I think trying to time it with temperature charts is a bad idea. So really every 2 or 3 days, a couple of times a week during the cycle. And that's because sperm lives for a few days in the fallopian tubes, and also the eggs live for a few days after they've been ovulated. So it's not like in some of the rom-com films where the woman's saying, I'm ovulating, we must have intercourse right now. It's not like that. Nature actually has arranged it that there's a few days leeway either side.
Yeah. So the fertility window is actually a few days, not just a 24-hour window.
Exactly. And some of my patients have been have been very keen to try and time it. So the woman has been checking her urine ovulation levels once or twice a day, and they're doing that. They're tracking ovulation all of the time. The problem with that is it can really give extra stress, because they're then really overthinking what's happening with their body. And if things are a day or 2 late, are getting really worried about it. And it's actually no more successful trying to do that than it is just having intercourse when you feel you want to.
Mm-hmm. So what are the effects of stress and external factors on fertility?
Really good question. So interestingly, stress, which is obviously very common in modern society, and very common in areas of the world where there's conflict, when people have looked to see, does stress cause infertility, it actually doesn't. So the problem with stress, I think, is more how people cope with infertility. So obviously if people are feeling very anxious or worried or stressed, and if they're not getting pregnant month after month after month, it means that they may tend to cope less well with that. And that is why at Child Fertility, we're very focused on giving a very holistic support to people. We recognize that failing to get pregnant is very stressful for the woman and her husband, and so giving support And that's in terms of helping them understand what's happening, the right tests at the right time and the right treatment. But very importantly, emotional and psychological support can help.
And, obviously, around the world, but more so in this region, in the Arab world, there's a lot of cultural and societal pressure on couples to have a family and get pregnant as soon as they get married, or as young as possible. So, how much does that affect the emotional stress of this journey through fertility?
Absolutely, and I see that. I mean, obviously, I've been most of my working career has been in the UK, but obviously, I've looked after people from many different ethnic and religious backgrounds as well. So I've seen that in action. Also, some of those family pressures that perhaps are more significant in some cultures than in others, and perhaps in some cultures less understanding of if there is an issue, less understanding of perhaps feeling sympathy for the person who's suffering with lack of getting pregnant. So again, from our point of view, from a clinic point of view, and this is all of the staff from start to finish, so all the different teams that work within the child fertility clinic, it's absolutely vital that we offer support and we understand particularly some of those cultural differences. Now, I think, as I mentioned though, having stress and anxiety will not stop people getting pregnant. It doesn't stop women ovulating, month after month. It doesn't stop their periods. It doesn't make a man's sperm quality worse, but it can affect their relationship. It could affect how often they have sexual intercourse. And as I mentioned, it could really affect, for example, people thinking, well, maybe this is so stressful, I'm going to stop trying to get pregnant. And if that happens, obviously, there's no chance of having a baby. So we need to do everything we can to really support couples during this time.
Yeah. And also, a lot of people don't talk about it. So we'd like to normalize the conversation about fertility and infertility and seeking treatment, because often couples are going through it alone and they're afraid to share that with their families and friends.
Yeah, and I mean, how did you, when obviously you spent some time working and studying in Oxford, did you sort of feel there was a difference perhaps between maybe general UK attitudes to fertility amongst the population and in the region here?
I mean, I think the issues that people face within fertility and infertility is a global thing. It's spread across all cultures and countries, but it is less. It's harder to communicate about it in this part of the world. I think because there's some sort of shame associated with infertility or not having children. So it's definitely more of an open conversation in other countries. So we'd like to bring that over here in Saudi Arabia and open up that conversation, the platform for patients to feel, for all people to feel comfortable to discuss these issues.
I mean, interestingly, it wasn't that long ago in the UK that it was quite similar to what you've described. I mean, IVF, I mean, you're younger than me, so it seems a long time into you, but the first IVF baby in the world was born in the UK in 1978. There's been a really good film on Netflix called Joy that follows that whole journey through. It's a drama, but it follows very accurately through. And you see that in the UK in the 1970s and 1980s, and even into the 1990s, it was considered really taboo. The whole subject of IVF and infertility, people didn't talk about it at all. And I started working in IVF in the 1990s. And even at that time, it was still not something people spoke about. And patients would come in and they would say that no one at work knows about it. Even often their family, their parents wouldn't know about it because they were embarrassed. They felt the stigma and the shame of it. And I'd say in the last 30 years in the UK, there's been quite a big change. And now you see it on TV a lot. There's lots of programs where people within the program are having IVF as part of the drama. And it's really helped people feel less ashamed of something which is a common thing. I mean, around 1 in 6 to 7 couples in Saudi Arabia will be having problems getting pregnant. That's the same number, the same percentage as it is in the UK and the rest of the world. It's really common. It's not something to be ashamed of. And the more that we can talk about it, as you say, Yasmeen, the more we can talk about it, the more we can take that stigma and shame away.
Yeah. And, this is affecting, like you said, 1 in 6 couples around the world. So that's millions and millions of people. And in Saudi Arabia, I guess it's becoming more open for people to discuss it. Every once in a while you hear like, oh yeah, actually I've had an IVF baby, and then that encourages other people to share their struggles and difficulties, or whether it was a success or a failure in their journey.
I think as well, obviously with the rise of social media, if you go back 20 years or so ago before social media, then really, unless people knew someone or they saw someone on TV or in the newspaper talking about it, it often was quite difficult to be part of a community of people who are going through the same thing, fertility struggles, or into treatment. Whereas now, with whether it's TikTok or Instagram, whatever it might be, or Snapchat, then there are many channels and many communities that people can share their experiences and also hopefully demystify. The only downside, I would say, though, is on those social media channels, there's also a lot of misinformation. So people will, for various reasons, will put information up there that either knowingly or unknowingly is completely wrong and can actually scare people. And that's why it's very important that people who are worried about their fertility speak to a trusted person or trusted provider to demystify all of this.
Mm-hmm. So let's talk a little bit about what's being marketed to the general public as, for example, fertility supplements or things to eat or things to take that will help their fertility. So what do you recommend a couple to take as supplements or lifestyle factors that will help their fertility?
Yeah, I mean, there are certain things that people can do to optimize their fertility. So certainly smoking is really bad for male and female fertility. So smokers have a higher pregnancy loss or miscarriage rate than non-smokers. So stopping smoking is very important. Weight is also important, and obviously worldwide that is an issue with increasing body mass index. So we know that for men and women, their fertility does reduce as the body mass index goes up, and particularly if it goes above 30. So try and normalize body mass index as much as possible. So I'd say weight and smoking are two big environmental factors. If you're then getting to things like diet, in Europe now, the big buzz phrase for healthy diet is the whole Mediterranean diet. And obviously a traditional Saudi diet, as far as I can see, looks pretty healthy. So what you're trying to avoid is processed foods. So reducing the amount of processed or ultra processed foods is very important, and eating lots of food from different food groups, multicolour food with lots of different natural vitamins and antioxidants is really important. Now, once you start getting into supplements, then for women, the really important supplements are folic acid, because taking folic acid before and during pregnancy reduces the risk of a really nasty pregnancy complication called spina bifida. So all women who are thinking about getting pregnant or trying to get pregnant should be starting on folic acid, which is available in all of the pregnancy multivitamins. And also vitamin D is important as well. So folic acid and vitamin D are the two most important for women. But normally, if you get a pre-pregnancy or a pregnancy multivitamin, it will contain that and all of the other types of ones as well. On the male side, we don't really know whether supplements are beneficial or not. A lot of them are being sold, are being pushed very hard to people to supposedly improve sperm quality. We don't know for sure whether it does. I don't think it does any harm, but again, I would really focus on not smoking and optimizing weight before worrying about supplements for men.
And what about exercise? How important is that for fertility?
I think exercise feeds into obviously general health clearly, and probably reducing stress levels for people as well, which, as we said, is important to how they cope with infertility and also the processes of different treatments that there might be. So I think exercise, moving daily, that keeps you healthy. It keeps the weight down. So of course, as a doctor, I'd encourage everyone to exercise. So certainly 3 or more times per week of getting your heart rate up, or if that's not possible, then 10, 15,000 steps a day, whatever it might be, it is important.
So let's talk a little bit about the biological clock, which, obviously women hear that phrase a lot, but it also affects men. So what is the realistic fertile window or biological clock for men and women?
Yeah. So starting with women, first of all. So women are born with all of the eggs they'll ever have. And I think that's often a real shock to people, even people who've had quite a high level of education. When we say that, often they're really surprised by that. So women are born with 2 or 3 million eggs in their ovaries. And the numbers of eggs that are there actually starts going down from before birth. And it keeps on going down, down, down from 2 or 3 million until there's about between 1,000 and 10,000 left. And that's when the menopause happens. So the menopause, it generally happens around the age of 50 to 52 years, and it's pretty much the same in all cultures around the world. So what happens is the numbers of eggs goes down over time. And many people think, well, they must go down because they're being used up by ovulating, by releasing, having a period. But women can only have about 400 periods in their lifetime, and that's 400 eggs. So most of these eggs just die off naturally. Now, that is something called the ovarian reserve. So there's a really good blood test that we often do to measure a woman's ovarian reserve, or how many eggs she's got. And that's something called anti-Müllerian hormone, or AMH, that we can test in our IVF centre at Child Fertility. And it's one of the tests we get done early on in a woman's fertility assessment. So the AMH tells us the number of eggs. But the second important thing is the age of the eggs. So, as I said, women are born with all of the eggs they're ever going to have. And obviously, as women go through their reproductive life and get older, we know that the egg number goes down, but we also know that the genetic quality of the eggs goes down as well. And there's no test for that, apart from to say to someone, how old are you? Now, the biological clock, when you hear that, and it's a horrible phrase, I know that, because you can sort of hear the tick, tick, tick going along. But the biological clock probably mainly refers to the age factor of the genetic quality of the eggs. So we know that if we look at an IVF cycle, for example, for a woman up until the age of 35, whether she's 25 or 34, the success rate is about the same. From the age of 35, mainly because of the genetic quality of the eggs, it does start to drift down. And beyond the age of 40, goes down quicker. And by a woman's mid-40s, IVF success rates are actually very, very low. So I'd say from a biological clock perspective, it's really mid-30s when things start to happen. But it's not that the biological clock means a woman's fertility falls off a cliff on her 35th birthday. There's a drift downwards. And I've had patients say, oh my God, I'm 35 next week. Is that the end of it all? It's not. It's just a drift downwards. Now, on the male side of things, it's not the same, because men continue to produce sperm through their life, which is how you have Mick Jagger of the Rolling Stones and some of these guys who are in their 80s who are still having children. Having said that, there is still a link with older men and a reduction in fertility and the chance of having a baby. So there is a link, but it's not as strong as the link between age and female fertility.
So, shall we discuss some common myths surrounding fertility, or whether they're scientifically proven or not? So, what about environmental heat? They say that the climate in this part of the world is really hot, or if somebody works a job that involves a lot of heat, or is a chef, or has their laptop on their lap all day, does that affect their fertility?
Yes, on the female side of things, we don't think there's really much of a link between sort of heat and fertility, obviously because the ovaries are deep inside her abdomen. On the male side, there's been a lot of thoughts about whether there really is a link. I think environmental climate change probably isn't having an effect on fertility, because it's a change of a few percent, but it's not. I don't think it'll be affecting male fertility. But certainly we know that sperm counts are dropping around the world. So there is a reduction in sperm counts over time. We're not entirely sure why that might be. It might be due to environmental toxins, pollution, or many other things we don't really understand at the moment. It might be because men tend to be fatter now than they were 30, 40, 50 years ago, with increasing obesity. But from a heat point of view, the testes are outside of the body for one reason, and that's to keep them cooler than body temperature. So yes, you're right. If a man has an abnormal sperm result, or if he's worried about his fertility or trying to optimize his fertility, it's important that he should try and avoid overheating his testes, so avoiding sort of lots of hot baths or saunas, jacuzzis, those sorts of things, looser fitting underwear or clothes. There were some studies suggesting that taxi drivers, because they're sitting down all day, may have a lower sperm count than, for instance, the non-taxi drivers. Now, whether that's true because of temperature or something else, we don't know. But yes, I would agree with you. So just trying to generally cool things as much as possible. That doesn't mean jumping in a cold ice bath. It just means trying to avoid situations where the testes are overheated. probably will help. But I don't think I've ever seen a patient where the only reason for his low sperm count is because of his job and heat and things like that. It's all little bits that can add together.
And just jumping to something different. So if a man were to get a vasectomy, because they're not looking to have any more children at the moment or for the foreseeable future, and then 10 years, 15 years later, they decide to reverse their vasectomy. How reversible is a vasectomy, and will that have an effect on their fertility in the long term?
That's a good question. So if a man has a vasectomy, then it should be considered an irreversible procedure. So men should be really sure about having a vasectomy, that they really do not want any children afterwards. A vasectomy can be reversed surgically. And basically, a urologist using a microscope would join the tubes back together that have been cut. But the longer that it's left after the vasectomy, the lower the chance of success. So very often we'll talk about 7 or 8 years after the vasectomy, maybe up to 10 years. And the longer that you go up to 7 years and beyond, then the lower the successful chance of actually joining the ends of the tube back together and having sperm back in the ejaculation sample. So many men might think, well, if that means it's too late. So if I'm not having a vasectomy reversal, or if I've had a vasectomy reversal and it's not worked, there's no sperm in my sample, that means I can never have any more children. Unfortunately, that's not true, because there's a very common procedure called a surgical sperm retrieval, or SSR, that we perform in the clinic, where the team, under anaesthetic, the team will take a small biopsy from the testes, and a direct biopsy from the testes. We will then give that biopsy of tissue over to colleagues such as yourselves in the lab, and then you'll look through that for sperm. Now, the amount of sperm that's found in an SSR is minute, but it can then be frozen, and it can then be used as part of an IVF treatment cycle. And for men who've had a vasectomy and where we're doing a surgical sperm retrieval, we're getting sperm in about 90% plus of time, so we can nearly always move on to do an IVF cycle.
And for women that are taking a contraceptive pill for many, many years, and then they might worry about, will that affect my fertility or my ovulation when I stop the contraceptive pill? Does it have an effect on their fertility in the long term?
That's a really common question, and I've had general practitioners ask me the same question, and they've not known the answer to it. The reassuring thing is that no, it doesn't cause any problems at all. So when women are on the contraceptive pill or other forms of contraception, all that it's doing is it might be stopping ovulation. So it's preventing them releasing an egg each month. It does not prevent other eggs in the ovaries dying off, so they don't have their menopause at a later date because they've been on the pill for 10 years. It all happens at the same time. But when they come off the contraception, whether that was a tablet or an implant or something else, then for most women, their ovulations and their periods will get going again within a few months. It does make sense, though, if people are planning to start getting pregnant at a certain point, to consider coming off the pill or whatever contraception it might be a few months beforehand, just to be sure. Now, if there's a delay in their periods coming back, then again, we can see them to actually get some hormone blood tests done and an ultrasound scan done, just to make sure there's no underlying issues as to why periods haven't yet returned, but nearly always they do with time.
Can you share some fun facts about fertility?
Fun facts about fertility. So it's really, I've seen so many patients over the years that have come in who've just been so worried about the fact that they have not got pregnant. And that might be because they have a lack of periods due to polycystic ovarian syndrome, so PCOS, that we'll talk about at some point. And they are just so sure that means they cannot get pregnant. And I think the majority of people, if they see the right clinic, they have the right investigations, in the majority of times we can actually help people get pregnant. It may involve having to have some extra treatments rather than getting pregnant naturally, but for the majority of people, we can. I worked in Canada for a few years. I remember I had a couple there had been trying to get pregnant for 18 years. So 18 years of trying to get pregnant. They felt there'd been no hope. They hadn't been to see, or they'd seen a GP who hadn't referred them on. So they hadn't actually had any treatment. And then after a few treatment cycles, the team, we got them pregnant after 18 years, which I think is the record for me for the longest time. So I've seen people who really have given up hope. where, and it's not that we're here to give false hope to people, but we're here to really assess what their situation is and to give them the information so that they can make an informed decision about what is the right treatment for them, or even if they want treatment at all. So it's hard for me to think of fun facts to do with fertility, but I think interesting things are that so twins. So I think one thing is people always think that so with IVF, for example, twins can be quite common, but that's because when we do IVF, in some places, when we do IVF, multiple embryos are put back into the woman. In the UK now, we only ever put one embryo back into a woman. So the multiple birth rate in the UK now with IVF is about 3% or 4%. A natural multiple birth rate, people getting pregnant naturally, is about 1%, about 1 in 80. In some areas of the world, such as in this region, the multiple birth rate is higher because often more than one embryo is put back, and that carries other risks, which we'll come on to at another time.
So through natural pregnancy, is it more common to have identical twins or non-identical twins?
Yeah, so most natural twins are non-identical. And a non-identical natural twin is because the woman, or natural triplet, if they're non-identical, is because the woman is releasing more than one egg. So that can run in families. So non-identical twins can run in families because if someone's mum has had non-identical twins, then the daughter might be more likely to be someone who also releases more than one egg. Identical twins is a chance nature thing where an embryo, which is a fertilized egg, just decides to split. And so they are obviously identical copies, which is why identical twins look the same. That is actually less common than non-identical. So even within IVF and fertility treatment clinics settings, most multiple pregnancies you see are non-identical, and it's because more than one embryo has been put back.
Yeah. Well, thank you so much. I think we'll end it there. Thank you for sharing all the basics of fertility. That really helps our patients gain a better understanding of their fertility and making informed decisions for building their family.
Thank you, Yasmeen. Thank you.
So we hope you found today's session useful. If you'd like more information, then please visit childfertility.com, where you'll find lots of information on the website and articles, or follow us on social media.